How would you like to save money for your hospital by replacing 4 oxygen delivery devices with 1? By replacing the nasal cannula, simple mask, partial rebreather mask, and non-rebreather mask, you can save money, improve patient oxygen therapy compliance without reducing SpO2, prevent rebreathing of dangerous CO2. The mask in question is the OxyMask, and it should be the primary oxygen delivery device in your hospital. First, in terms of liter flow, OxyMasks can replace the use of 4 different oxygen delivery devices: the nasal cannula, simple mask, partial rebreather mask, and the non-rebreathing mask. This is possible because, quote, clinicians can now respond to the patient's changing oxygen needs and deliver 23 to 90% FiO2 by simply increasing oxygen flows from 1 liter per minute to flush to maintain the desired SpO2 percentage, close quote. Before the OxyMask, you would need the nasal cannula for low flows, as well as the simple mask, partial rebreather mask, and the non-rebreather mask to cover the same range of flows. In her case study of OxyMasks improving patient care, Lisa Kindler found that the OxyMask had a large impact on our post-anesthesia care unit, PACU, where nurses are responsible for setting up oxygen for their patients. The nurses frequently had to find themselves having to try 3 different devices to either increase or reduce the amount of oxygen the patient was receiving. With the OxyMask, they now use 1 device for the patient and simply adjust the flow to achieve the ordered and desired oxygen level. Not only was the patient care improved and nursing was simplified, we also saved money by replacing the number of masks that were used in the PACU area. In addition, OxyMask can improve patient compliance with oxygen therapy without reducing the patient's SpO2. The OxyMask is designed with large openings in the sides, which allow for room air entrainment. These large openings also reduce the likelihood of claustrophobia when compared to the traditional closed masks. These new masks also provide easier communication between patients and clinicians. Furthermore, the article OxyMask Advancing Oxygen Therapy for Better Care notes that, quote, for the clinician, the large openings in the mask allow for easy access to the nose and mouth for food, drink, medication delivery, suctioning, oral care, and even laryngoscopy or bronchoscopy procedures. As traditional oxygen devices must fit tightly onto the face, there is not easy access should the patient require a nasogastric tube. With the open design of OxyMask, the mask does not need to be secured tightly to the patient's face, and it provides easy access, close quote. This means that in many circumstances, the OxyMask does not require removal, thus preventing a dangerous drop in the patient's SpO2. One of the most important reasons why your hospital should use OxyMasks is that because of the large openings, OxyMask can eliminate the rebreathing of CO2 that can be common when the oxygen flow is too low in the traditional masks. Patient safety is increased since, quote, CO2 leaves the mask upon exhalation. A minimum flow rate is not required to remove CO2, which is often required when treating with a traditional closed OxyMask. In conclusion, saving money is not the only perk you and your hospital will see by switching from traditional masks to OxyMasks. Using the OxyMask will improve oxygen therapy compliance, will prevent reducing the patient's SpO2, and will eliminate fears about rebreathing dangerous CO2. Do you see your hospital saving money on oxygen delivery devices in the future with OxyMasks while improving the patient oxygen therapy compliance without reducing SpO2 and preventing the rebreathing of dangerous CO2? If so, provide them for your hospital now.